Hey everyone, welcome to another episode of Health Zone with Gilbert Chia. I'm Gilbert Chia, I'm the editor of Health Zone Singapore, a Facebook page that's dedicated to covering health and wellness issues, specifically from a Singapore and a regional perspective. So this week, we're going to talk about COVID. We've been in this pandemic now for about a year or slightly more, and yet there's still a lot of questions that people have got. And in fact, as we learn more about the disease, and we have the vaccines coming out, and more things are happening around the world, people have even more questions. And along with these questions, there's also been a lot of misinformation, a lot of speculation, a lot of myths, and I want to set the record straight. So this is a very important show. Please listen, watch, and share with your friends. I'm going to be answering questions that people have been asking about COVID and stating the facts that everybody needs to know about. So let's get started. Question number 1. Everyone's been hearing a lot about the new variants of the disease. So how dangerous are they? Should we be worried? Well, viruses are actually always mutating, and sometimes they can mutate into more dangerous forms. In the case of the COVID-19 virus, we are hearing a lot about 3 new variants that have made the news: the UK, Brazil, and South Africa variants. However, these are not the only variants. In fact, and this may really surprise you, since the start of the pandemic, there have been over 65,000 mutations and over 5,000 distinct variants have been identified. But the vast majority of these mutations have no effect in making the pandemic or the virus worse. So why have these 3 made the news? Because they are suspected to make the virus more transmissible, meaning it's more contagious, so this means more people can get sick. But so far, the good news is that although they make more people sick, they have not been shown to make people sicker. So the level of illness or deaths are not higher. The variants are behaving in much the same way as the older variants. We also need to understand that a virus being more contagious can indirectly lead to more deaths if the country's medical system is affected and unable to cope with more patients. This is the situation, for example, in the UK, which is one of the reasons why the British Prime Minister Boris Johnson warned that the UK variant could be more dangerous. Not really because it is individually more lethal to a person, but because having more people getting sick means the country's already beleaguered health system would not be able to cope. Now, there's a very important point we need to understand. Viruses can only mutate if they are in a host. They cannot just change unless they are inside a human body. So if fewer people are infected, the chances of mutations will be much lower. The new variants transmit in the exact same way as the old virus. So all the precautions we have been following for the past year must be followed even more closely now. And this includes proper mask wearing, social distancing, avoiding crowds, especially indoors, not touching your face with your hands, washing your hands frequently, and going to the doctor if you feel sick. This is very important to understand because if people get the wrong idea that somehow the viruses are going crazy regardless of what we do, they will just give up and start being callous, which will have a cascading effect and really make things much worse. So in addition to the vaccines, a country's medical infrastructure, the political leadership, and community compliance and safety measures will all play a big role in how deadly any virus is. Question 2. Do the vaccines we have work on these new variants? Now, there's been a lot of misinformation and sensationalism about this, so I really want to make things clear. All the experts agree and observations have shown that the vaccines we have are all effective against the different variants. Vaccines train the immune system to attack several different parts of the virus, so even though maybe one part of the spike of the virus has mutated, the vaccines do still work. Now, there are reports that one vaccine from AstraZeneca is less effective against the South African variant. But the tests they did were only on a small sampling, and it only showed less efficacy in preventing mild to moderate symptoms, but it was effective in preventing serious illness. Now, this is a very important point. We hear a lot about efficacy percentages, such as one vaccine having 96% efficacy, another vaccine only having 60%. And people and the news media are obsessed with this word efficacy. And people talk about these percentages as if they understand it. But most people actually have no idea. So what does this efficacy percentage actually mean? These are clinical trial measurements as to whether someone in the clinical trial gets any symptoms at all after getting the vaccines, such as a cough or a cold or a fever. So if they test the vaccine on, say, 1,000 people, and 900 people do not get any symptoms of COVID at all, but 100 people do have some symptoms, then they will say the vaccine has an efficacy of 90%. And the measurements are very strict. So if someone even gets a slight cough or cold despite getting the vaccine, they are counted as one for whom the vaccine did not work. But this overlooks the most important point. The vaccines work in preventing serious illnesses and deaths. So even though they are not 100% effective at preventing everyone from getting mildly or moderately sick, they are effective at preventing everyone who gets the vaccines from getting severely ill or dying. It's the same with flu vaccines that are released every year. They don't prevent you from getting sick with the flu, but they make the flu much less serious and deadly if you catch it. And the COVID-19 vaccine that was similar is that they may not stop you from getting any symptoms, but it will make it much less likely that you will be hospitalized or die. And this is the most important point, because if people get moderately sick, they can stay home until they recover. But if people get severely ill, they need to be in hospitals and in intensive care, which leads to hospitals being overloaded and medical staff being overwhelmed. And it also means that people with other health problems are unable to get medical care. This is what happened the whole of last year, and what is still happening in many countries where they have run out of hospital beds and run out of ventilators and people die. So the toll on societies and lives is terrible, which is why having vaccines that can help stop this is so important. And the great news is that we have several vaccines, all of which work in greatly reducing serious illness, hospitalizations, and deaths. And also, vaccines can be updated and boosted when we get more data in. And even now, they are being improved on. So if we vaccinate everyone, the level of hospitalizations and deaths will fall dramatically. And that is what the world needs. So please do not obsess about the efficacy percentages. What matters is whether the vaccines prevent serious illnesses, and they do. Third question, how quickly does the vaccine work and how long does it last? So both the Pfizer and the Moderna vaccines, which we have here in Singapore, are 2-dose vaccines. And we see a good immune response that comes in about 2 weeks after the first dose. And after the second dose, there's an even stronger immune response that develops even faster. But we don't know yet how long this immunity lasts because people have just started getting vaccinated. But there are clues. Scientists know that coronaviruses in general don't change as rapidly, unlike some other viruses. For example, the ones that cause influenza. Those require new vaccines every year. Researchers also know that the antibodies which are generated by the COVID-19 vaccine in humans disappear very slowly. So they believe there will be protection for potentially a couple of years. And also, science has built coronavirus vaccines already. And when they administer these vaccines on animals like pigs, for example, the vaccine protection is considerably longer and can last the animal's lifetime. So we are not quite sure right now how long this vaccine will last, but the chances are it will last for quite a good while, and you can always get a booster shot. Moderna's chief medical officer also said that the company expects the vaccinations should last at least a year. And they do plan to do booster shots, so even if the vaccine's effect fades, it's possible to refresh it in the same way as we do for vaccines for other diseases such as hepatitis A. Question 4. Can you still get infected after getting vaccinated, and can you spread the virus? Now, as it takes about 2 weeks after vaccination for the body to develop immunity against the virus, it is possible for a person to get infected after being vaccinated. And that means it's entirely possible for you to then infect someone else with the virus. And this is why we should still be wearing masks even if we have been vaccinated. But, and this is a very important but, the vaccine will prevent you from getting seriously ill, which in effect makes a potentially deadly disease relatively harmless to you. And the vaccine trains your immune system on how to attack the virus. So before long, your body will learn to kill the virus even if you are infected. Question 5. Will COVID be with us forever, as some experts say? Now, I hear this a lot. Now, it is highly likely that the COVID virus will be with us forever. But that does not mean it will keep killing people or making them severely ill. Instead, it will likely be another kind of flu virus that many people will have immunity to, and some will get sick from, a few might die, but the overall number of people will be okay. And how do we know this? In the entire history of science, ever since we started studying viruses and developing treatments and vaccines, only one virus has ever been successfully eradicated, and that is the smallpox virus. Every other virus that has killed or made humans sick through the years is still with us. But just because we have not eradicated a virus does not mean it is still a danger to humanity. Viruses that cause the world's most dreaded diseases and that have killed millions of people, such as polio, HIV, rabies, Ebola, flu pandemics, etc., have all not disappeared and they are still with us. But they have been tamed and controlled with vaccines and effective treatments, and that will be the same for COVID. We will still have it around, but like these other viruses, it will not be something that we even think much about. Now, my bonus question number 6, which I think is very important, which I want to address. People ask, why are we still allowing people into Singapore, increasing the number of imported COVID cases? Shouldn't we just shut the borders completely? This is one of the most misunderstood and contentious topics these days, because as the number of local community cases are close to zero, more attention is being paid to imported cases. But let's get some facts right, because there's been a lot of ignorance and misinformation about this, and often it's fueled by malicious xenophobia. Singapore cannot afford to close its borders, especially to migrant labour. Many of the people who are coming in these imported cases are migrant labourers. Our roads and homes will not be built, businesses will not have staff to operate, elderly people and families will not have the domestic workers they need, hospitals will face a nursing and staff shortage, and so on if we close our borders. The damage to our society and economy from closing the borders will be far worse than anything we can get from imported COVID infections. Very importantly, it's also important to note this. We are not just allowing people in without strict safety measures. All visitors are quarantined upon arrival, so there's very little chance of them spreading the infection. When you read about the imported cases, they are from tests done at the end of the quarantine period when these people are already recovering from the infection. It's also important to put things into perspective. Throughout the whole past year, of all the incoming visitors, less than 1% have tested positive. It doesn't make sense to stop all incoming travel, which will damage our society economy, to prevent the 1% of incoming travelers who are being quarantined anyway, and all of whom recover without any issues. One final word about this pandemic. Despite all the pain, hardship, and lives lost during the past year, we are all really fortunate in many ways. For one thing, we have not one but several effective vaccines, and this is something we really should be thankful for. Vaccines are not automatic discoveries. Many diseases that have killed millions of people for decades still have no vaccine. HIV is a very good example. It's been killing people for over 40 years, and until today, there's still no vaccine. So for us to have several effective COVID vaccines is really extraordinary. In addition, there are effective treatments to help the sick people get better, even if they are hospitalized. And doctors now know a lot more about how to treat this illness. The bottom line is that we have many reasons to be optimistic based on science. In the US, for example, there are uninformed, ignorant, and malicious people who have politicized this virus, and they deny it even exists. That's just insane. But here in Singapore, we have people who do the opposite. They are so pessimistic and fearful and keep relishing any bit of bad news they read, and they keep predicting doom and gloom and death and dread. This is just as ignorant and uninformed. Too many comments on social media distort the reality. The danger in this negative mindset is that people feel despair and they feel that it will never end and they will give up doing the things they need. Everyone needs to realize that this virus and pandemic is being beaten right now, and that vaccines are playing a crucial role, and that we all need to do our part to make sure that this ends, and it will end. So stay positive, get your facts right, and don't spread misinformation and fear. That's it for this week of Health Zone with Gilbert Chia. I hope you found this to be effective and helpful and informative. And please do share it with your friends, and we'll see you again next week. Thanks for joining us.